Welcome to More Precious Than Rubies, where we explore and celebrate the stories of women in our modern world. I'm Ariana, and in this season, I'm meeting incredible local women in their space and learning what they've built, while they quite literally walk me through it. Today, I'm at Empower Physical Therapy in Rancho Bernardo to talk about something that affects so many women, but a lot of us were never really taught to understand: pelvic floor health. We're going to walk through what pelvic floor PT actually is, what happens at an appointment, what symptoms women shouldn't ignore, and a few practical tools that can help us better understand our bodies. So let's go meet Dr. Colbert. We were talking a little bit about this before. You kind of saw that there was a gap in women's care when it came to physical therapy. So what did you feel was missing in women's care, and how did you kind of use that to shape the kind of clinic that you wanted to build?
Yes, thank you for asking that question. So I started Empower after the birth of my first baby. So that was 7 years ago now. And it was after my own pelvic floor issues and experiences, just because after you have a baby, you realize that there is basically no care for down there. I didn't mean to rhyme just then, but you feel that there really truly is a gap. So I've been a pelvic floor therapist for about 10 years now.
Okay.
And I always knew about pelvic health, but it wasn't until I had my first baby that I truly understood what my patients were going through when they came to me postpartum. So after you leave the hospital, you get maybe one visit with your gynecologist, and then after that, you never see them again.
Sure.
So I was like, wow, you really go home with no education about how to take care of your body. No one really checks in on you other than that one postpartum visit, as opposed to when you're pregnant, you get visits once a month or every couple of weeks, depending, what stage you're in.
Yeah.
And it just felt like a stark difference. After you get an injury, you should ideally go to physical therapy after you injure your knee, or let's say, to be more specific, tear your ACL. There's a rehab process that you go through, and the doctor will say, I recommend PT twice a week for 6 weeks or however long it takes. The same thing should happen, I feel like, to a postpartum woman, or at the very minimum, maybe at least, half of that.
Right.
Because we are giving birth to a full baby through our pelvic floors, through our vaginas. Or, we're giving birth via a cesarean section, which is a major abdominal surgery. So they're cutting into those muscles. Those muscles need rehab. And if you are giving birth via vaginal birth and you tear, you strain those muscles, which most women do, those muscles need rehab also. So that's kind of where Empower steps in. That's what got Empower started. But beyond that, we help women with all their pelvic health issues. So all of our clinicians here are well qualified. So kind of what the process looks like when you come in is it's by appointment only.
Okay.
And we do an initial evaluation first.
Okay.
So that you might find us through online or by a referral, but people usually book themselves online, and then they come in for an initial evaluation, which involves it's almost like a typical physical therapy evaluation, but taking a look at the pelvic floor as well. So that also might involve an internal pelvic health exam.
Okay.
That may intimidate some people. It's our first time meeting.
Sure.
I don't know who you are. And then we immediately go to a pelvic health exam. That can feel a little bit vulnerable. But I like to assure people that we want you to feel completely comfortable when you come in. And if that is something that you are not comfortable with right off the bat, there are plenty of other things that we can do. And an internal pelvic health exam is not absolutely necessary for the first visit.
Yeah, because when I've talked to other PT friends of mine or girls that are going through PT school who have an interest in pelvic floor therapy, something that they've talked about is the importance of coming to women who may have had sexual trauma or sexual abuse, where something like that might be a little bit traumatic for them when they're first walking in here. So it's good to know that you're saying you don't have to do that off the bat if you're not comfortable with it, because that can be hard for people, I'm sure.
We like everyone to know that they are in complete control of how the exam goes. So if there's ever anything they feel uncomfortable with, of course, we make things completely comfortable. So there shouldn't be an instance where they feel like, you know, just exposed. But yes, we like to educate on pelvic floor muscles first and explain like what the exam is about and what we'll be doing step by step. And then as we're doing the pelvic health exam, if they consent, we're also explaining what we're doing as we're doing it so they feel completely comfortable. That was the intention when I created Empower, that we would be an all-female staff and we would only treat female pelvic floor dysfunction, honestly, because that's what we're trained in. That's what we're really good at, and we specialize in that, but also to make anyone that comes to Empower completely comfortable.
So for the woman who's watching who has heard the phrase pelvic floor, but doesn't really know what it means, can you give us a little bit of a look into what is it and why does it matter for our bodies? So you have some helpful anatomical models. I would love if you can show.
Perfect. Okay, I'm so excited to share a little bit more about what the pelvic floor is and what it does. And we have a model here to kind of show you guys in more detail what the pelvic floor looks like. So this is our pelvis. So this is our pubic bone, and in the back we have our tailbone and then our hip bones on either side. If we take a look at from the top down at our bodies and we kind of take all these organs out, we have our pelvic floor. So
and the red rubber is the muscles that surround the pelvic floor, right?
Yes. So some people also call this like the pelvic bowl because it's kind of like a hammock, which holds all our organs up. So all those organs that I just removed, here we have our uterus, we have our bladder, and then we also have the rectum right here. So our pelvic floor holds up those organs, so that's one of its functions. It's also responsible for keeping us continent. So you hear about women.
It's probably what most women hear about it from.
Yes. So we have pelvic floor muscles surrounding our bladder neck. And one of the most common pelvic floor issues is, I pee a little bit when I laugh, cough, or sneeze, which commonly happens after you have a baby. And it's because those pelvic floor muscles are weak. So that's another one of its functions, is to keep us continent and then to let things out when we need to let things out. So one of the pelvic floor problems that is not commonly known is constipation or just difficulty urinating. So again, trouble letting things out. It should keep things in when we need to keep things in and then let things out when we want things to come out. So if the pelvic floor muscles are really, really tight, you see that we have 3 holes in there. One for like the rectal canal, vaginal canal, and urethra. If the muscles are really tight surrounding those areas, it can make it really difficult for our poop or our pee to come out. So one of our roles as a physical therapist is to release the tension in those muscles.
So that would be the internal exam, I'm assuming.
So that would be the internal exam. So what we would do in an internal exam is, if we look through here, and this is the vaginal canal, we would take one glove finger inside the vaginal canal with lubricant, and then we're assessing the muscles on the inside. So we're assessing for tension. And you know how when you have a knot in your shoulder, it feels like hard and stiff and uncomfortable. We can feel the same type of texture inside the pelvic floor. So if a muscle is tense, it might feel like a little bit hard. And that's how we know that there's some tension there and it needs to be released. So we're assessing for that. And then we might also assess for strength. So we'll ask someone to do a Kegel.
Yeah.
I don't know if you're familiar with what a Kegel is, but it's a contraction of our pelvic floor. And we'll just grade that. Like we'll see how strong is the pelvic floor on a scale from 0 to 5. 0 being like no strength, like we don't feel anything happening. And 5 being like really strong.
I think a Kegel is like you said, something that most women are like, oh, I know what that is. I think it's interesting because as I got older, I started to kind of be able to practice Kegels, but I wonder how difficult is it for you to explain to somebody that movement? Because without being able to, like when you're a PT and you can move someone's arm physically and show them what you mean, but how do you explain a Kegel to somebody who may have never done one before? I'm so curious.
Oh yeah, so oftentimes when people come into the office and I say, do a Kegel, and they're like, I know what that is. They're not doing a Kegel.
Really? Interesting. Okay.
So, or they're doing it very incorrectly.
Okay.
There is different cues that I like to use, like verbal cues and kind of visual cues that I like to give to get someone to engage the right muscles. And what I'm doing is internally, I'm feeling if those muscles are activating and which muscles are activating. So is it like the superficial muscles that are more at the front of the pelvic floor, or is it like the deep pelvic floor muscles? So I'm assessing kind of both things and then in different quadrants of the pelvic floor. You know how you have like one hamstring or one quad that can be stronger than the other?
Yes.
So it's kind of similar, like one side of the pelvic floor could be stronger than the other side. So we're assessing both those things. Like I said, an internal exam is not absolutely necessary, and there are things that we can do externally. So if someone does not want an internal exam, I can just take a look at what the pelvic floor is doing from the outside. And see if there is that rise in the pelvic floor when I ask them to contract, and then if there's a descent of the pelvic floor when I ask them to relax. And there should be a good excursion of those pelvic floor muscles visually. If there isn't, it's either one, they just don't know how to access those muscles. There is like a difficulty in the mind-body connection there, which is very common for a lot of women because a lot of us or a lot of women have like some shame around that area, or just like after they've given birth, don't even want to like think about that area, or just like kind of ignore it. And what I was saying is, one, they might not have that excursion because they don't have awareness, or they are really tight in those pelvic floor muscles and do not have the mobility to make it contract or relax.
Pelvic floor PT may seem intimidating to some women if they've never been, or again, if they've had that trauma in the past. So could you explain a little bit, who is pelvic PT for and what does their first appointment look like?
Yes. So pelvic floor therapy is for anyone that has a pelvic floor. So that also includes men. Men have a pelvic floor. Children have a pelvic floor. Us specifically at Empower, we only treat female pelvic floor dysfunction, and we don't do pediatrics. So just if any person out there notices that their child or husband is like struggling with some supposed like pelvic floor issues, know that there can be help for them at like another pelvic floor therapy clinic. But pelvic floor therapy is for anyone that is experiencing issues in this region. So let's say like from like your diaphragm to, you know, the bottom of your pelvis. So that might look like pelvic pain. So anyone that has painful periods, cramping, anyone that is having trouble conceiving. So I'm going to list just like the things that maybe people might not think that pelvic floor therapy can help with. But yeah, those are two big ones that people might not know about. If they're having trouble conceiving, if they're preparing for birth. So if they're just trying to get those muscles ready to have a baby come through them, either this way or this way. And then also postpartum recovery. So after we talked about this before, if a woman has a baby via C-section or vaginal birth, rehab for those muscles. Pelvic organ prolapse.
Okay.
Have you heard of that before?
No. Please explain.
Okay.
That would be helpful.
So pelvic organ prolapse is when one or more of your organs fall into the vaginal canal. So we have our bladder, our rectum, and our uterus. So if for some reason the pelvic ligaments or muscles get weaker, we can get something called prolapse, which is a descent of these organs into the vaginal canal.
Okay.
And it might feel like a heaviness or like a dragging feeling, or feeling like you have something in your vagina, like a tampon or something. It can feel really uncomfortable. The common misconception is that pelvic organ prolapse can only develop after you've had kids.
Okay.
But that's not true. Although it's less common, I've had someone come in who's never had kids and has had a pelvic organ prolapse just from lifting something. So it can be from improper mechanics of like straining, bearing down too hard and causing one of those organs to descend into the vaginal canal. When someone comes in for a pelvic floor therapy appointment, we will usually do like a gait analysis to see if there's any improper movement patterns. We look at other movement patterns like a squat, a single leg stance, like a single leg squat, balance, things like that. We look at their range of motion of their back and their hips. And then we might get them on the table and look at hip alignment. So we look at the bony pelvis. We look at like alignment from head to toe. And what I like to do, and my therapists like to do too, is we like to treat as we go so that we're not wasting any time. Like if we see something, if we see that there is some imbalance there, we might just correct it. And then we also look at range of motion of like the hips. And then after that, we'll explain what an internal exam is. And then do an internal exam if we have consent. After that, we will do like an abdominal assessment. So we'll see like, how does the core contract? How well does someone breathe? What does the breathing mechanics look like? And some people are like, I know how to breathe, but when they come in, it's just all discombobulated. And most of us do not know how to breathe, actually. So we just live in such a go, 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 high stress society these days. And so our shoulders and our diaphragm kind of like live up here. And there can be what's called like paradoxical breathing, where we're breathing like with our chest rather than with our diaphragm. And our diaphragm and our pelvic floor is so connected. Yeah, we look at breathing pattern, look at the core, and then we might educate a little bit more on that. And then we'll do like a strength assessment of the core and then strength assessment of the legs. And then after that, we'll prescribe exercises or some homework based on what we find.
Well, I'm looking forward to a little bit later when we go out, seeing if my gait is any good. So as you can see, we've changed locations. We're now in another beautiful part of Dr. Colbert's clinic. So she's going to walk us through some exercises that are going to help everyone at home kind of get a quick look into how we can better our pelvic floor health. So to start, Dr. Colbert, can you walk me through some exercises that help women understand how the pelvic floor connects to the rest of the body? And I'm going to show you all, and Dr. Colbert's going to kind of talk us through what that looks like. So
our pelvic floor is the bottom of our core canister. So it's actually part of our core muscles. So if we think about a canister, like a soda can, like the top is our diaphragm. The bottom is our pelvic floor, and the surrounding canister is our back and our core muscles, like our abdominal muscles in front. And when we breathe, it very much impacts how our pelvic floor moves. So as we inhale and kind of breathe in, our diaphragm descends and our pelvic floor descends at the same time. And the canister kind of moves up and down. And so as we exhale and the air comes out of our lungs and our diaphragm rises, our pelvic floor comes up with it because it has direct fascial connections to our diaphragm. And then whenever we engage our core, ideally our pelvic floor should also be engaging. So whenever we engage these abdominal muscles. All right, so you're gonna lie on your back.
Okay.
So we are going to kind of walk through what core and pelvic floor engagement will look like and feel like, okay? So you're going to inhale through your nose first. And then as you exhale, you're gonna blow out through your mouth and think about stopping the flow of urine. Okay.
Oh, okay. Got it.
So we're just going to bring awareness to our pelvic floor first. And I am actually going to have you put your hands on your lower abdomen, just like that. And when you inhale, I want you to think about filling up your lower abdomen so that your hands rise. So you're going to inhale. So that's one cue that I like to give when trying to engage the pelvic floor muscles. Let me give you a couple others, okay?
Yes.
So go ahead and inhale again. And then as you exhale, think about sucking a smoothie through a straw with your vagina.
Okay.
So I know everyone laughs at that one. And it is very visual.
That feels like a faster exhale than the previous one.
Mm-hmm.
Does that sound right?
Mm-hmm.
Okay.
I mean, everyone kind of thinks of it differently. And usually what I am doing when I'm cueing these exercises, I'm doing an internal exam.
Okay.
And I'm feeling what your pelvic floor is doing. Right now, what I'm doing is I'm looking at your core to see if your core muscles are engaging properly. Now, as you inhale, you're just going to think about filling that lower belly. And then as you exhale, I want you to think about closing all your holes. Okay. I know I said that was the last one, but I just want to give you one more.
Okay.
Now, as you exhale, I want you to think about picking up a blueberry with your vagina.
Is it right that I'm squeezing my glutes as well for that one?
Ideally, no.
No. Okay.
So, everything surrounding your pelvic floor should be quiet.
Okay.
So your glutes should not clench. Your
Okay.
legs should not clench. It's a very subtle movement. So save that for home too, just to kind of understand what the pelvic floor contraction feels like and think about those cues.
Okay.
But let's bring awareness to our core now, our abdominal muscles here. Okay. So I'm going to have you do the same thing. We're going to use our breath. Inhale, think about filling that lower abdomen gently. And then as you exhale, think about zipping up your abdomen like a zipper. Like there's a zipper running from your pubic bone to your rib cage. And as you exhale, we're just zipping up those muscles. And then as we inhale, we're fully relaxing. You might notice a pattern here. It's always relax on the inhale, letting everything go, and engage as we exhale.
Okay.
So as we're inhaling, we're letting everything relax, our core, our abdominal muscles, our pelvic floor.
Okay.
And then as we exhale, we are engaging our pelvic floor. We are engaging our abdominal muscles in there in the front. Okay, one more cue that I'll give you. Now I want you to think as you exhale, you are these two hip bones knitting them together. Okay, so inhale. And then as we exhale, knit those two front pelvic bones together. Good job. I think that was the best one. All right, so we got all the components. You're gonna put it all together now, and we're gonna add an exercise to it. So it's kind of like pat your head, rub your belly sort of thing. That's what people feel like when I cue these exercises, but that's totally normal because you're doing this for the first time.
Sure.
It may look easy from the outside. It's hard to tap into those muscles altogether. Okay? All right, so we're gonna do something called a bridge. So what that looks like is just lifting your hips off of the mat. So let me see you do that right now. Lift your hips off the mat. Good, and then come back down. We are going to do our diaphragmatic breath in conjunction with the lift, okay?
On the exhale?
On the exhale. So you're gonna inhale first. Think about relaxing and filling that lower abdomen with air. And then as you exhale, blow out, engage your pelvic floor. Go ahead, pick up that blueberry, zip your core, lift your hips off the mat. Good. Inhale to come down. We're gonna do one more. Exhale, lift the pelvic floor, draw in the core, good, and lift up. So sometimes when someone leaves here and let's say we did the internal exam, or I've tried to cue the pelvic floor muscles and things are just not connecting,
Yeah.
I will just have them work on the breathing, and that's it.
Sure.
Like, that's plenty to work on when they go home, because that's probably something they've never done before. They have no idea that there are pelvic floor muscles down there. They don't know that we can engage them. They don't know that we can engage the core, or that we should be thinking about those muscles, and use our breath to engage those muscles.
And especially if their breathing is up here, like you said, even just shifting that to more of a diaphragm breath can be challenging in itself, I'm sure.
Exactly.
Because it's like a pattern. If you walk with a certain gait or pattern, it's hard to correct that after you've done it for so long. Because it's like reforming your body to something that it's not used to. Yeah.
I also want to mention that pelvic floor therapy is very biopsychosocial. So we're also asking about lifestyle factors that might influence the pelvic floor. So a couple questions we might ask would be like, how much sleep do you get at night? That will tell us about someone's cortisol levels, or what is your stress level like on average from 0 to 10? And then also we ask about the background, if there's any trauma in the past, or if they have any mental health help that they're seeking out.
Yeah, that's fantastic.
The mind-body is very connected.
So we were just talking about deadlifts and squats and how those are some exercises where we can really practice those things. So now can you kind of show me how, if someone is familiar with a deadlift and a squat exercise, if you're not, we're going to show you right now.
Yes.
So let's talk about how we can kind of engage those muscles while we're doing those exercises.
Okay, perfect. So like we practiced on the ground, we are going to think about inhaling to relax and then exhaling to contract. So just think about that whenever we're doing these exercises. But I'm going to have us grab a kettlebell.
Oh, good. We're getting a workout today, guys.
Yes, we are. Okay, we're going to hold it like a goblet.
Got it.
Okay, we're going to face each other here, just like that.
Goblet squat?
This is called a goblet squat. Okay. So as we lower, and we can make sure that we're set up correctly here, so our feet are a little bit wider, and our feet are shoulder width apart. When we inhale, we're going to come down, and then as we exhale, we're going to come up. So it's going to look like this. Inhale to come down. Exhale to come up, blow out through our mouth, and we are thinking about zipping up our core and engaging our pelvic floor at the top. Okay. So inhale, exhale.
Oh, that's different. Yeah. I'm not used to engaging my pelvic floor in a squat.
Yeah, we'll do it again. Inhale to come down, and as you exhale, think about picking up that blueberry with the vaginal muscles and zipping the core. Okay, inhale. Exhale to zip up and lift up.
Oh, that's different. That's so different. Oh my gosh.
Okay, so we're going to move to a deadlift now. When I do a deadlift, I am hip hinging. It doesn't look like I'm rounding my back out like this, which is a common mistake. We are really shifting those hips back. Those knees stay soft as we lower the weight down. And then we're using our glute muscles to pull up rather than our lower back, okay? So it's gonna look like this. We're gonna inhale to come down, and then we're gonna exhale to come up. At the top, we're zipping our core and picking up the pelvic floor again. Okay? Let's try that together. We're gonna do 5. So we're gonna inhale to come down. Good, zip those hips back. And then as we exhale, we're gonna draw in our core, lift up our pelvic floor. Good. Inhale to relax, come down. Exhale to contract. Awesome.
Yeah, that's really different. I'm definitely not used to engaging the pelvic floor when doing these exercises. It's all I'm like, oh yeah, I know how to engage my glute muscles and not use my back, and but the pelvic floor never comes into my mind when I'm.
It's actually a much safer way to do it, because what that will do is decrease your risk of prolapse, so that strain, and then also protect your back.
Yes.
So I like to use another cue I like to use is exhale on exertion. So whenever it's the hard part of the exercise, you are exhaling, and hopefully just the more familiar you become with these muscles and the muscles down here, your core and pelvic floor, they will just engage automatically.
Yeah, that's
true. We start out really being really cognizant about, okay, what's my pelvic floor doing? What's my core doing? And then eventually it's just like, okay, just breathe. And hopefully that those muscles just engage on their own. A lot of times when people come in, I will feel a lot of pelvic floor tension.
Okay.
And like I talked about before, we are just such a go, go, go society that a lot of us live up here. We're tensing our neck muscles, our shoulder muscles, and these muscles are connected to the muscles down in our pelvic floor.
Okay.
So if we're doing this, our pelvic floor is most likely doing this.
Okay.
And we do not want to walk around with a clenched pelvic floor.
Okay.
Or like a clenched jaw or, clenched shoulders, because that really can lead to a whole host of pelvic floor issues.
Okay.
And oftentimes I find clinically that pelvic floor issues are not related to just strength, but it's pelvic floor tension. That's the culprit.
Okay.
And that often signifies to me that someone is probably walking around with a clenched pelvic floor. So we really want to tap into that diaphragmatic breath throughout the day. Think about relaxing the jaw. Think about relaxing the shoulders. Thinking about breathing into our lower abdomen. And the pelvic floor should just ideally be relaxed as we're diaphragmatically breathing to get that. I like to think of it like kind of like a buoy in the water.
Yeah. Okay.
If you can imagine a buoy just like kind of bobbing up and down, that's kind of what our core canister should be just doing on a daily basis, just throughout the day. Our pelvic floor and our diaphragm kind of just working in sync, nice and relaxed, just being able to kind of float and bob.
You've talked about the importance of pelvic floor therapy also for pregnant women. So the last question about some exercises that we can show people at home is, can you show an exercise that you teach women when they're preparing for birth, and maybe some practical things that they can do at home while they're pregnant that are best for their pelvic floor?
Yes. Actually, I'll show you one exercise that is great for just pelvic mobility. It's a simple exercise, but I just kind of want to speak to how important pelvic mobility is when we're preparing for birth, because this area is what the baby has to descend through and come out of when we are giving birth while we're laboring. So it's really important that we have good mobility of these muscles. One simple exercise is cat-cow, where you're on your hands and knees. We are going to inhale and like kind of arch our back and expose kind of the pelvic floor. Think about separating your sit bones as you're doing this.
Okay.
Good. And then as we exhale, we are tucking our tailbone under and kind of just stretching out that lower back and tucking our chin as well. Good. Inhale to come up and arch, and then exhale to come down. So this is something that I have, we can just keep going through these motions. This is something that I have women do to prepare their pelvis for birth, but they're also going to do it as they're laboring.
Okay.
So it's a great way just to kind of keep the pelvis moving, rocking it back and forth, because that's kind of what helps the baby descend into that birth canal.
Yeah, because it's this direction, right? That's how it's moving.
That's what we're doing. It's kind of like back and forth like this. I also like to have people kind of rock side to side or like do circles. Birth is very intuitive, so I don't like to kind of put like sets and reps to what someone is doing when they're preparing for birth. It's more about just like, what does your body feel like doing? Don't be afraid to like move into that and do what your body innately tells you to do. So just automatically, without me having to, because I've attended a couple births before, without me having to tell them anything, they are just like naturally moving and swaying in these positions. And it's just because they feel like that's what they need to kind of get the baby to come out. So that's one exercise I teach. Another tip I give them is not to give birth flat on their backs. Because if you think about it, And that's kind of what we see in the movies, right?
Yes.
We see that the woman is flat on her back, her feet are up in stirrups. And she's like screaming and her face is turning red. And she's having like a really, really hard time getting that baby out. But ideally, our face should be relaxed. We should be breathing. And ideally, we should not be flat on our back because studies show that leads to more pelvic floor issues and a longer labor. If you think about it, when we're flat on our back, our sacrum, I don't know if the camera can see this, but when we're flat on our back, the sacrum is blocked by the table. And if we look at the sacrum here, if it's blocked by the table, that limits the pelvic outlet right here. So our sacrum can extend up to 15 degrees when it's unblocked. So that is one tip I like to give is in your birth plan to put, ideally, I would not like to give birth in lithotomy or flat on my back because that is limiting the tailbone's ability to extend or the sacrum.
That's like sacred space right there that it could just limit tearing too, I'm sure.
Right, totally. Because like if there's not enough space for the baby to exit, then so much strain is put on those muscles. Yeah, we want them to be off their back. So ideally like in a side lying position on the hands and knees, or you could also, if they do kind of want to be resting right here, put some towel rolls right underneath the sit bones to make space for that sacrum.
Okay.
And then ideally they're not doing this whole thing.
Bearing down,
But like they do have to bear down a little bit. So they are bearing down, but not holding their breath.
Okay. Got it.
Because that can really put a lot of pressure on our pelvic floor, and actually also kind of causes our pelvic floor to contract a little bit too. So we're doing something that's kind of opposite, contracting our pelvic floor, but also like bearing down, that can like lead to tearing. We kind of just want the pelvic floor to give way and like exhale and breathe the baby out instead of doing that whole thing.
So interesting. The last question here is, what do you hope that women feel after coming here and learning more about their bodies?
So no pun intended, but I really hope that women feel empowered when they come to Empower Physical Therapy, just because we educate so much on their bodies and what's normal, what's not normal. So really, I feel that in that education, in having more knowledge, that they feel more comfortable and confident, knowing that there is more than what maybe is common knowledge that people are telling them. There's more help for pelvic floor issues and they can do something about it. Another thing I feel I would love for people to feel is that they don't feel isolated in the pelvic floor issues that they're going through. A lot of times I think that this journey can feel so isolating. One, because there's still a lot of shame and maybe taboo, the feeling of that these topics are taboo when talking about it. And because of that, people are not sharing about their pelvic floor issues. So I hope that by coming here and feeling comfortable, knowing that like they aren't alone in this process, that it will feel like less isolating and that they can tackle these problems head on, knowing that, you know, there's someone else walking alongside of them in this journey.
Dr. Colbert, thank you so much for spending time with me today, showing me some exercises and educating me about pelvic floor therapy. This has been amazing.
This is amazing. Thank you so much. It's been awesome.
Yes, agreed. This is so fun. And for anybody that's watching at home that's interested in Empower Physical Therapy, I'll put their information in the description box below.
If you just want to learn more about us first, there is an option to book a 15-minute phone consult and talk to one of the therapists first.
This is something that I think is an important topic for any woman, like I said, and it's an often overlooked part of women's health. So what a fantastic way to kind of introduce people to a topic that isn't much talked about. Pelvic floor therapy is not just about one stage of life, one symptom, or even one exercise. It's about helping women understand their bodies and ask better questions, and even realize that they don't have to do it alone and they don't have to live with pain, leaking, pressure, or discomfort. So if you enjoyed this episode, be sure to subscribe, leave a review, and tune in next time as we continue to explore the lives of remarkable women. Until then, you're worth far more than rubies. Set about your work vigorously with arms strong for your tasks, open your arms to the poor, and extend your hands to the needy. Charm is deceptive and beauty is fleeting, but a woman who fears the Lord is to be praised.